Regardless of where patients are seen in medical practice, we need to have a high index of suspicion regarding symptoms of depression and depressive episodes. Whether we're working in oncology, OB-GYN, with perinatal depression, postpartum depression, perimenopausal-related depression. We're working with patients who have had recent surgery, for example, that may also encompass some sort of physical impairment or physical disability, and particularly in primary care and family practice. Depression may be far more common than we think. When we consider that in any given 12-month period, approximately 6.7% of the population may meet a diagnosis of depression, that 1 in 4 individuals during the course of their lifetime will have an episode of depression. Women, we find, have a higher occurrence than do men. Of patients who may come to us for treatment, approximately 3/4 of them recognize the need for treatment. Of those of depression, only 77% receive optimal treatment. One of the other things that we find in treating depression is when treatment is initiated, within the first 6 months, nearly half of those patients will discontinue treatment that is prescribed for them. So one of our goals in our practices in terms of treating patients with depression is to engage patients with shared decision-making practices, provide optimal goals for treatment and outcomes, and measure those outcomes as we implement treatment and progress towards that endpoint of optimal functioning and quality of life.